Hello and welcome to this open enrollment presentation for the internal employees at KPG Healthcare for the 2026 open enrollment plan year. Quick agenda, we're going to talk about a brand new benefit offering called self-funded, very different approach. A company called UMR, which is owned by United Healthcare, is something that we're going to ask you to become very, very familiar with. Talk about open enrollment timelines. We'll touch on medical, dental, and vision. Our UNUM plans are still in place. There's some employee education points we want to discuss, and then we'll talk about next steps. So what's new and what's not? Our medical, dental, and vision approach is brand new. Life and disability, as well as accident and hospital plans, all offered through UNUM are staying the same. So with medical, we're making a move into the self-insured world. This is a very different approach. United Healthcare is the PPO network. That's the doctor network we'll be accessing, and UMR is the name of our third-party administrator, which is going to be the main point of contact for all of us. We'll be getting familiar with them in the coming slides. Dental and vision offered through United Healthcare. And again, Unum stays the same. So what is self-funded? So really self-funded is when your employer says, I will take on the risk of paying these claims instead of giving hand over fist to the insurance companies for them to profit on. This means the risk is on your employer. This means that the savings that we have as taking on this risk potentially can be, the potential savings would be passed along to employees. So this is a different way to budget the healthcare. The idea here is that we guess right, and the profits that would otherwise be going to the pockets of the insurance companies are reverted back to us. This is more stable rates, more predictable rate increases, not these 15 to 18% and sometimes 24% increases that we've been seeing, and we're protecting the employees from these big increases as well. So better visibility into what we're spending helps us get smarter benefits in place. We can target benefits. We can create different things in our health insurance strategy that answers directly what our employees need. And then if the claims are lower than expected, the employees benefit. So the idea here is that future rate increases are as small as they need to be, because all the savings will generally be passed along to the employees so that our rates become as stable as possible. And so we keep those excess dollars that would otherwise be going to them. There's more freedom to customize our plan so we can upgrade things and change some of these things, the benefits whenever we want. Stronger wellness and support programs, so better mental health support, better telemedicine, lower out-of-pocket programs for expensive prescription drugs. Lots of different ways that we're going to be able to address with precision programs that help employees live better and healthier lives. All of this is an investment in our employees, a more stable benefits culture, keeping coverage as affordable as we possibly can, and offering long-term better benefits. So who is UMR? UMR is our third-party administrator. That's the term for them. They're the ones that are organizing and pulling together all the different components of this medical plan. They are where we're going to start with all of our questions that we would normally have for our insurance company. So claims issues, finding doctors, understanding benefits, handling prescription drug issues. They are going to be our main point of contact going forward through this arrangement. So getting started with them, first we get our ID cards. We'll have these digitally before we have them physically in hand. So if you have a need for them sooner, please let your HR department know. They'll work with our team to get these for you. Once you have your ID card in hand, then we can create an online account at umr.com. We can download the app and explore the online dashboard. Lots of amazing tools, especially as you get to using your plans around how much of my deductible have I met? Where can I find doctors? Help me explore new treatment options. Give me to centers of excellence when it comes to my healthcare. Great customer service number here at 800-826-9781. Once we have all of that, we want this UMR app, check-in benefits, finding doctors, how much did I spend, different options, saving money on prescription drugs, all of it through the UMR app. Other things that are available to you, health education, libraries. digital magazine for you called Healthy You. Lots of helpful resources here on making the most of your benefits, understanding your benefits, controlling healthcare costs, understanding preventative healthcare, understanding claims, how to read your ID card, filing claims online. Lots of good tools and resources here. Understanding your ID card, let's get into it. Right up here at the top, your member ID. This, of course, is what your doctor needs to see. Here's your dependents, if any, listed here. Down here, you're going to see your network logo. You'll see your United Healthcare logo on here. That's giving you access to their PPO network. Up here's the other big number doctors need to know, the group number. Then for prescription drugs, here's all your numbers right here. All very important numbers that providers need to see. Down here, you're going to see some benefit details that show you what plan you got. Number 7 is very important. This is your UMR care number. This is only when you have medical needs that need or medical services that require prior authorization. This is the number you will call. This is the number the medical providers will call to say, we're trying to get pre-approval for this particular condition. I always recommend you ask them to get pre-approval. Makes the process go much, much better. Over here on the right, number 8, this will be your customer service number. Remember the claims, doctors, benefits, general questions. And at the bottom here, pharmacy questions and issues go there. Open enrollment, this is when we get to make our choices. Now, remember, so much of this is new, so it's critical you log in, you enroll, you figure out if it's worth it to you, if you want the plans, which plans you want, what's best for your family. We have medical, dental, vision, and all the Unum products. This is where you can make any changes you want, but our open enrollment deadline is Friday, December 12th. It's very important we meet that deadline. The rest of your company's employee enrollment is counting on all of us. We're only as fast as the slowest person here. So please help us out. Thank you. Qualifying events. So this is when you gain or lose access to coverage throughout the year due to moving, due to birth of a child, marriage, divorce, COBRA incident. So if you have a qualifying event and need to either join the plan or be removed from the plan or add dependents or remove dependents, you must let your HR department know within 30 days. If you're listening to this video, you're eligible, but speaking of children, up to the age of 26, your biological children, stepchildren, adopted children, foster children, spouses, domestic partner, these are all eligible dependents for you. So key terms, we have deductible. This is the amount the insurance company says, we need you to pay all of this amount before we start to pay. The higher the deductible, the lower your per paycheck cost. Copays, these are the fixed dollar amounts that you would pay for doctor visits, urgent care specialist, these type of things, prescription drugs to $20, $50, $100 amounts. These usually are right away. You do not need to meet your deductible first when you see a copay like that. Co-insurance, this is after you meet your deductible. This co-insurance means you pay some and the insurance company pays some. So where you see 20% or you see 30%, this is explaining that you would pay 20% after you meet your deductible. The insurance company pays 80% until you reach your out-of-pocket maximum, which that is the ceiling. Once you've spent that amount in a calendar year, you are no longer asked to pay anything else for your covered services for the rest of the calendar year. These refresh on January 1st every year, but if you hit this number in a calendar year, that means no more is going to be asked for you to pay out of pocket. And premium, this is the amount you're paying on a per paycheck basis. It's your membership fee for the membership to the insurance policy, the PPO network, the out-of-pocket maximum, all of that kind of stuff. Recommendation or reminder, I should say, to get your preventative care. So important. The early detection of health problems keeps your costs down, keeps your quality of life up. Early detection of things can make a big problem very small and very treatable. So please take advantage of the preventive care visit benefit. We've got a PPO plan, which means what it always has meant. You can go see so many different providers, primary care providers. You can choose one, but it's not required. Specialists are available. There will be deductible, copays, co-insurance, and out-of-pocket maximum. So here's a look at our plans. We've got the same look and feel for our plans as we did last year. We've got our $500, our $1,500, and $3,500 deductible plans. The higher the deductible, the lower your per paycheck cost. You can see your per paycheck rates here. There was an increase to the contribution from your employer for both the employee and then an additional amount for those of you that have dependents. So we are seeing a relatively significant rate increase, but there has been also a significant increase in what KPG is paying towards your premiums. The idea here, of course, is that this new arrangement allows these premium increases to level off and have lower, hopefully closer to into the single digit increases in future years. So that's a note on the premiums. These PPO plans use the United Healthcare Choice Plus network. We also have two EPO network plans. These are exclusive provider organizations. They are part of the United Healthcare Core Network. This is a national network, so you can have this all over the country. There's different deductible amounts and different premium amounts, as you can see. Different types of care to choose from. Make sure you're always going to the place that's right for you. If it's an emergency, you got to get to the emergency room, but understand there's no more expensive place in this country to access care than the emergency room. So please understand how and where to use urgent care facilities, where the nearest ones are to you, leaning into the telemedicine benefits that are available as well. Speaking of, we have Teladoc Health and Teladoc Health Primary 360. On the left, we've got our traditional 24 hours a day, 7 days a week connection with psychiatrists, behavioral health experts, doctors. People can send prescriptions. All kinds of access to different basic health needs can be happening through the phone or through a online portal. And then our Primary 360, this is great for those of you who just don't have time to schedule primary care doctor visits. Maybe you're having trouble getting one soon enough and you want to get a handle on some of your primary health care needs. This is a way to do that, truly have a primary care visit virtually through the Primary 360 benefit offering. Fantastic offering. Encourage you to take advantage of it. Additional well-being solutions. So this is our EAP, our Employee Assistance Program. Lots of opportunities to get help for all kinds of issues here. This is first base. This is your starting point for your mental health, behavioral health journeys. If you're having issues with anxiety, depression, stress, alcohol, drug abuse, marital issues, financial issues, identity theft, work-life balance, elder care help you need, this is your place to start. It's available 24 hours a day, 7 days a week. There's referrals available, and it is a robust program that is something that we really, really encourage you to use. Also, Optum RX is our pharmacy benefit manager. We are able to access them directly to pay less for prescription drugs. We can check the drug prices. We can get them delivered to our home for savings, sign up for automatic refills, view our claims and benefit information. So lots of helpful ways to manage your medications online through this particular site. For those of you that end up with specialty drugs that can be very, very expensive, cost you a lot of money out of pocket, we have a new medical RX advisor. If you qualify, they'll reach out to you directly. This is when you end up with prescription drugs that are very expensive. We have a team of advisors and advocates that can help you find manufacturer discounts that can offer copay assistance and get these costs, these out-of-pocket costs, from thousands of dollars down to maybe dozens of dollars. So very, very helpful program. Also, for those of you looking to start a family or grow your family, really great opportunities with pre and current pregnancy through the Care Nurse solution. It's through UMR. If this is of interest to you, there's a QR code and a phone number there to call to complete an online enrollment form. Don't imagine you'll need to file a medical claim because your doctors usually do, but this is a great time to hit pause on the video and take a snapshot of that QR code and access these steps to submit a claim. Let's talk dental. We've got our dental plans at DPPO. This is the kind of network you want. This is the kind of network you've had. It's large, it's national. It gives us access to our United Healthcare dental plan, which is a mirror image of our Cigna plan last year. It's a $2,500 per person maximum benefit. It covers 100% of expenses for diagnostic and preventative services. all the cleanings. It covers 80% of basic services, which includes cavities all the way up to root canals and deep cleanings. And then there's a 50-50 split for crowns and dentures and part fixed denturals, prosthetic bridges, these type of things. $1,500 per person lifetime orthodontia benefit. Up to the age of 19 is eligible for orthodontia. We also have a new exclusive network dental plan. This is going to feel like an HMO dental plan, but it is going to really perform like a PPO. So it feels like an HMO plan because you have copays for everything. It's not this percentage of the cost until you get to your out-of-pocket, your out-of-network maximum or your maximum benefit, and then they pay nothing. There is no annual maximum. There is no need to choose a primary dentist. There is fixed and affordable copays, and you are really in what feels like a PPO network. So you do have a much larger network access than you would if you were in an HMO, but everything's a copay. So really good, affordable dental plan for those of you that might not be as picky with who you see, but want an affordable way to access quality dental care. Very good option here. Here's how you get your digital dental ID card. There will not be physical ID cards sent to you, so you do need to sign up in the UHC app to get access to this. Once you are enrolled, you'll be able to do so. We can help you through HR get your ID numbers. Remember, this is going to be only with the United Healthcare app. Vision's also United Healthcare. As a reminder, great. Vision coverage is a great thing to have because they can find many medical issues through basic eye exams. So good reason to buy the Vision plan. Another good reason is it's affordable and it's comprehensive. It's very good. It is, you get a $10 eye exam once every 12 months. You have a $15 or $25 copay for new lenses once every 12 months. And you have a $180 allowance for frames every 12 months. If you go through that $180 allowance, you got another 30% discount on top of it for most all brands in the retail space. So you can also get contact lenses instead of glasses. Here's how you print your Vision ID card. If this is something that you need to do, make sure that you've hit pause and follow the steps now. Here's some of the ways, or some of the brands you can expect to see in the large national network. On the right, you'll see some of these brand names you're hoping to see. Down the middle here, you'll see how you get more information on how to access providers. myuhcvision.com is where you want to go. Dental and vision only with the United Healthcare app. So let's talk Unum. We've got Unum available to us for several different policies. There's a life insurance policy of $25,000, which is purchased on your behalf by your employer. There's nothing you have to pay here. Everybody gets it. You can buy additional voluntary term life. Up to $70,000 is guaranteed if this is your first time enrolling. If you're newly eligible, this is your guaranteed issue amount. If you have already been through enrollment or have already had this opportunity, any additional amount or any enrollment you have will come with a need for an evidence of insurability form to be completed to be approved. You can elect up to $500,000 if you wish. Again, you'll have to fill out a health questionnaire to be approved. Disability is paid for on your behalf for internal employees. There's up to a maximum weekly benefit of $13.57. The way it works is you would get 60% of your weekly income, not to exceed $13.57 for a whole year. Then there's a long-term disability policy that also covers you. After that year is up, then you're going to get 60% up to $13,000 all the way to your normal Social Security retirement age, which could be 60 some odd years old. And there is, it's an employer paid benefit, really great benefit that you have already. There's accident insurance. So you can buy different levels of accident coverage for yourself. You'll be able to do this through the enrollment portal. And there's just different amounts you can have. For those of you that have the deductible plans and kids playing sports, or maybe you're a mountain biker, snowboarder, maybe you're a pretty active person and might have emergency room visits, something like that, might be good to buy the accident plan. There's a critical illness plan for those of you that might have in the family history of any cancers, heart attacks, organ issues, infectious diseases, any of these type of things. A critical illness benefit will pay you if you come down with any of these. And again, the amounts of payment are in the enrollment portal for you to choose from, but really good for those of you that have some of this going on in your family history, unfortunately, to kind of insure against it so that if it did occur, you would have access to a lump sum funds. Then there's the hospital insurance benefit. This one I am strongly recommending, especially for those that are in that $1,500 and $3,500 deductible plans. This is a good buy in case you do have a hospital stay. You get $1,000 right off the top, and every day you're in the hospital, you get another $100. Those numbers double if you're in the ICU, and if you wind up in the emergency room, you get $100 for that. So really nice benefit there for those of you buying the higher deductible plans to kind of cover your bets a little bit should you have a hospital stay. Here's the numbers for claims, filing claims, or talking to Unum about the benefits. For the long-term disability program that you all have, there is an additional travel benefit that's very, very helpful. There's translation assistance, there's help finding medical providers wherever you may be, emergency medical evacuation. Lots of really cool stuff comes for free. So if you are traveling abroad, I recommend either reaching out to Unum or your HR department to find more information on this benefit. So wellness benefit also. So if you access your preventative care benefit and do all of that, you'll get $50 per Unum plan, Unum voluntary plan you're enrolled in. So $50 for critical illness, accident, and hospital, up to $150 if you get any of these type of services. Education. So we will be sending you emails directly educating you on these things piecemeal, one at a time, small bites of benefit information to help make your experience better, to help you have the tools and the resources to have the best experience you possibly can. So please look at those, please accept those, and please know that those are coming for your edification and that only. We do not share your information. We do not sell your information. We are only trying to help train you on what is available, how to find different things, resources, tips, tricks, and hacks that can make your experience as good as possible. There's an employee benefits microsite at this link here, eb3.com/microsite/KPG. Lots of resources. This is what I want you to consider one of your first stops when you have questions. Information on any one of the resources you have available to you is right there. Drop downs, benefits summaries, resources on everything here. Lots of good information for you to find there, including this video. Action items. You got to decide, are we going to enroll or are we going to waive our plans? Research your providers to make sure they're covered. If you do not wish to enroll, we still need to ask that you log in and waive coverage. Please do so through the iSolved app like we've done in the past. And remember, your deadline is Friday, December 12th, please. If you have any questions, we're here for you. We'd love to help. Please reach out to us. Thank you so much.